It's every hiker's nightmare. You're trekking down a sunny path, becoming one with nature, when out of nowhere, a snake springs and strikes. In this situation, you need to know instantly how to treat the bite correctly. If treated the right way, even most venomous snake bites can be overcome. The following steps might save your life if you happen to be in such a situation. 1. Avoid steps that will worsen your situation. There are a lot of myths of how to care for a snake bite, and some of these myths could actually make your situation worse. Don't try to cut or suck the venom out. Cutting the wound could cause more problems and increase the risk of infection. Anyone sucking out venom may actually swallow some and be poisoned themselves. Don't use a tourniquet or ice on the wound. Experts believe that a tourniquet could potentially restrict blood flow too much, and ice can increase damage to the wound. 2. Call emergency services or shout out for help. If you are alone but can move safely, go for help. Most snake bites aren't dangerous, but when you do get bitten by a venomous snake, getting medical care as soon as possible is imperative. First responders will know the types of snakes found in the area and will be best equipped for the most appropriate treatment. Either call paramedics or get to an emergency room right away. 3. Stay calm and wait it out if you cannot reach medical care. If you're out in the wilderness with no hope of paramedics getting there soon, the best you can do is get as comfortable as possible and wait for the venom to leave your system. In most cases, snakes don't inject enough venom for the bite to be fatal. Treat the individual symptoms that may occur, and most importantly, stay calm and move as little as possible. Fear of snakes and the anxiety that follows being bitten are often what leads to fatalities, since a pounding heart makes the venom spread more quickly. 4. Take note of the snake's appearance. First responders and emergency physicians will need a description in order to determine if the snake was venomous. If possible, get a picture of the snake, or at least have a fellow hiker also take a mental picture of the snake to verify what you've seen. 5. Remove clothing, jewelry, or other constricting items. Bites from venomous snakes can cause rapid and severe swelling. Even a loose piece of clothing can become too tight as the bite area swells. 6. Immobilize and support the area of the bite. Do not apply a tourniquet, but do restrict movement in the bitten area. Also keep the area at or below the level of your heart. This will help make sure that if it was a venomous snake, the spread of venom is slowed down. Keeping the bitten part of you below the level of your heart slows down the flow of any affected blood towards the heart, which would then pump the venom throughout your body.